Have you ever had a nightmare? Have you ever had a nightmare several days in a row? I guess no one really enjoys having a nightmare. It's scary, not comfortable. However, do you know? Having nightmares actually can help you. So today, I will share some science behind nightmare. I am Dr. Yishan, a psychologist, sleep expert, and sexologist. I upload a new video every week. If you like my content, welcome to like and subscribe. Why do we have nightmares? It's our survival mechanism. When we dream, our brain will come up with some stories, sometimes scary stories like nightmares, to help us re-experience what happened before. Hopefully, we can learn from that to avoid similar awful situations from happening to us again. So you can see, nightmare has a good motivation. So our brain hopes to use nightmare to increase our chance of survival. But if the nightmare goes on and on, day after day, months after months, years after years, then that can become a chronic problem. Eventually, it starts harming our sleep and our health. Think about that. If every time we wake up suddenly in the middle of the night, our heart is pounding, we're sweating, we're so tensed up, it's super uncomfortable, right? If that happened to us a lot, we may not want to go back to sleep. We may worry about going back to the same nightmares again. Slowly, what we end up doing behaviorally, we may delay the time to go to bed because we are worried about dreaming. We may do whatever to make ourselves exhausted enough before bedtime. So hopefully we don't have nightmare, we can just pass out and sleep. So basically we are trying to run away from the problem, to avoid it. Here I want to clarify 3 common myths about nightmares. First one, if nightmare come from our real life stress or our past trauma experience, does that mean we have to deal with the stress or the trauma before we can sleep better? That's not true. So nightmare, it actually can become a learned behavior itself. Just like any other habit. Let's think about nail biting as an example. When anxiety got triggered, something happened, they got so nervous, they unconsciously start biting their nails as a self-comforting strategy. And they keep on doing this again. Eventually, they start biting their nails unconsciously even when they are not anxious. So basically, nail biting become a habit. Sometimes I would say anxiety is like a poisonous flower. Nightmare is the same. And the more attention we give it, the more we believe that's true, that's who we are, the more nutrition water this flower gets. This nightmare flower will grow bigger and bigger. So eventually, the nightmares start taking on a life of its own. There are very good evidence-based methods out there to treat nightmare, to help you sleep better at night. Of course, if you have a traumatic event happening, impacting your life, you should see a therapist. But you don't have to wait until you're fully healed in order to sleep better. These 2 treatments can happen at the same time. Second myth, can I just self-medicate myself if I suffer from nightmares? For example, some people feel like, well, no professionals, I just gonna drink myself to sleep. This actually is the opposite of what you should do. Even if we don't have nightmares, alcohol actually gonna really harm our sleep quality. So when we have nightmares, it's even worse. Why? Alcohol actually could increase our stage of this sleep called REM sleep, rapid eye movement. And this is the sleep stage we are really dreaming. And that's also the sleep stage where nightmare happens. So after you consume alcohol, this dreaming period got extended. It's become longer. And then you're spending more time in dreaming. That gave your brain a lot more space and possibilities for the nightmares to happen. And even worse, alcohol can help us remember the dreams more vividly after we wake up. And think about, you have more nightmares, longer nightmares at night, and in the morning you remember all the details of the nightmares so clearly. How stressful that could be, and what kind of sleep quality you can get if that happened to you a lot. So if you have frequent nightmares, please be really cautious about self-medicating your sleep. The third myth, well, if you have nightmare, you're doomed. There's nothing you could do. It cannot be changed. What? Absolutely not. As a clinician, I can tell you, nightmares can be changed for sure, just like any other forms of dreams. You can change the content of that, you can change the intensity of it, and you can change the frequency of it. Really good evidence-based effective treatment for nightmare I mentioned earlier called IRT, Imagery Rehearsal Therapy. Basically, this is a whole protocol based on what kind of nightmare and trauma experience you have exactly. Gonna target how to change the content and intensity of your dream. So what if you only have occasional nightmares, not much trauma history, it just somehow bothers you when it happens? What can you do? So there are two simple strategies you can try. One, limit the input of some negative information during your daytime. Remember, those negative news informations can really accumulate. Your brain feels like it has to work on processing those information at night. It may not happen directly at that night, but after it accumulates for a while, you will notice you start having dreams about those. And our brain does not have a predictable way to process those. Sometimes the brain can come up with some really scary stories in our dreams with the good intention to help us. Second, practice more positive, pleasant imaginary in your brain during the daytime. So for example, you can try this kind of 1 minute up to 5 minutes meditation practice every day, and just imagining some pleasant moments and guide yourself to come up with those images, those pictures in your head. You are experiencing the positive storyline in your brain. There are a lot of guided meditation like that can help you, even though it's not directly related to dream, but it's related to pleasant memory, pleasant imagery. The more you practice those during the daytime, the more positive accumulative effect it can have. And at night, when you are stressed out, when nightmare want to happen, your brain naturally can balance the negative and positive aspects out for you. So remember, our brain is trying to help you, not meant to make you suffer. How we perceive nightmares can also impact how we feel about it. Again, sleep is such an individualized thing. We all sleep differently. Accept who you are, accept how you sleep, let go of control. Sometimes could be the key for a good night of sleep. So what do you think about nightmares? How do you deal with it? Welcome to leave me a message down below. Let me know. I'm Dr. Yishan. Thank you for watching. I'll see you next time. Bye.